Welcome to today's lesson on medical phlebotomy terms. In this video, we'll explore the most essential vocabulary used in real-life phlebotomy practice, including tools, procedures, and patient care. Whether you are a beginner or looking to refresh your knowledge, this video will help you build a strong foundation in professional medical English.
Essential tools and supplies.
Needle. A sharp tool used to draw blood. Example: the nurse used a needle to collect my blood sample. Syringe. A small tube with a plunger to draw or inject liquid. Example: she filled the syringe with medicine. Vacutainer holder. A plastic tube that holds the needle and blood collection tube. Example: the phlebotomist placed the tube into the vacutainer holder. Tourniquet. A tight band tied around the arm to find veins. Example: the tourniquet helped the vein show up clearly. Alcohol swab. Small cotton pad with alcohol for cleaning the skin. Example: he cleaned my arm with an alcohol swab before inserting the needle. Gloves. Protective handwear to keep things sterile. Example: phlebotomists always wear gloves for safety. Gauze pad. A small piece of soft fabric to stop bleeding. Example: she pressed a gauze pad on my arm after the blood draw. Bandage. A sticky strip to cover the puncture site. Example: she put a bandage on my arm after removing the needle. Lancet. A small sharp tool to prick the skin for capillary blood. Example: a lancet was used to check the child's blood sugar.
Blood collection tubes.
Red top tube, purple or lavender top tube, blue top tube, green top tube, gray top tube, plain test tube.
Procedure and technique. Venipuncture. Drawing blood from a vein. Example: venipuncture is the most common blood collection method. Capillary puncture. Collecting blood from a finger or heel. Example: the baby's heel was pricked for a capillary puncture. Order of draw. The correct sequence for filling tubes. Example: the phlebotomist followed the order of draw to avoid errors. Hemostasis. Stopping bleeding after needle removal. Example: applying pressure helps achieve hemostasis. Labeling. Writing patient info on the tube. Example: the nurse labeled each tube before sending it to the lab. Specimen transport. Moving blood samples safely to the lab. Example: specimen transport must be done quickly to keep samples fresh. Safety and hygiene. Antiseptic. A chemical to clean the skin. Example: the phlebotomist applied antiseptic before drawing blood. Disinfectant. A strong chemical to clean surfaces. Example: the chair was cleaned with disinfectant after use. PPE, or personal protective equipment. Gloves, masks, coats for safety. Example: PPE protects both patients and healthcare workers. Sharps container. A hard box for used needles. Example: the needle was thrown into the sharps container. Biohazard bag. A red bag for medical waste. Example: the used gloves were disposed of in a biohazard bag. Patient-related terminology. Hematoma, or bruise. A bruise caused by blood leaking under the skin. Example: a hematoma formed when the vein was missed. Fainting. Passing out during blood draw. Example: the patient fainted after the needle was inserted. Needle phobia. Fear of needles. Example: many children have needle phobia. Collapsed vein. When the vein closes under pressure. Example: a collapsed vein made it hard to draw blood. Fasting. Not eating or drinking except water for a period before a blood test. Example: The patient was fasting for 8 hours before the blood draw. Allergy. A negative reaction of the body to certain substances, like latex or alcohol. Example: the patient has an allergy to latex gloves. Consent. Permission from the patient before doing a procedure. Example: the phlebotomist got the patient's consent before starting. Patient identification. Checking the patient's name, date of birth, or ID to avoid mistakes. Example: patient identification is the first step before any blood draw. Phrasal verbs in phlebotomy. Put on gloves or tourniquet. To wear or place gloves or a tourniquet before the procedure. Example: please put on your gloves before starting the procedure. Take off gloves or bandage. To remove gloves or a bandage after finishing. Example: after finishing, take off your gloves carefully. Roll up your sleeve. To move the sleeve up to expose the arm. Example: could you roll up your sleeve, please? Lie down. To rest in a flat position, usually when feeling dizzy. Example: if you feel dizzy, please lie down. Sit up. To move from lying down to a sitting position. Example: you can sit up now, the procedure is finished. Point out the vein. To show or identify the vein for blood draw. Example: the phlebotomist pointed out the vein before inserting the needle. Clean up the area or site. To disinfect or wipe the area before or after venipuncture. Example: we need to clean up the site with alcohol swab. Press down on the site. To apply pressure on the puncture site after the needle is removed. Example: please press down on the site with this cotton ball. Throw away or dispose of the needle or waste. To safely discard needles or medical waste. Example: throw away the used needle in the sharps container. Write down information. To record patient details or test info. Example: don't forget to write down the patient's ID number. Call in the patient. To invite the patient to enter for their turn. Example: we will call in the next patient now. Look for a vein. To search for a good vein to insert the needle. Example: the nurse is looking for a good vein. Set up the equipment. To prepare all tools needed before the procedure. Example: before the procedure, set up all the equipment you need. Carry out the procedure or test. To perform the procedure. Example: the phlebotomist carried out the venipuncture carefully. Follow up with the patient. To check the patient's condition after the procedure. Example: please follow up with the patient if they feel unwell.
Today, we explored some of the most essential phlebotomy terms that every beginner should know. Understanding these words will not only help you in your studies, but also in real clinical practice. Keep reviewing them regularly, and you'll feel more confident in your medical journey. Thank you for watching, and don't forget to like, share, and subscribe for more English for Healthcare videos.